12-lead electrocardiogram EKG practice test. Question 1. Where should the V1 lead be placed? Fourth intercostal space, right of the sternum. Fourth intercostal space, left of the sternum. Fifth intercostal space, mid-axillary line, on the right arm. V1 is placed in the fourth ICS at the right sternal border. Question 2. Which rhythm is characterized by an irregularly irregular RR interval and no P waves? Atrial fibrillation, sinus tachycardia, ventricular tachycardia, first degree, AV block. AFib is the classic irregularly irregular rhythm with fibrillatory waves instead of P waves. Question 3. What is the EKG criteria for a STEMI, SD segment elevation in 2 or more contiguous leads? SD segment depression, a flattened T wave, a short PR interval. SD elevation myocardial infarction requires elevation in related leads. Question 4. What is the normal duration of a QRS complex? Less than 0.12 seconds, 0.12 to 0.20 seconds, greater than 0.20 seconds, 0.04 seconds. A normal QRS is narrow, typically 0.06 to 0.11 seconds. Question 5. Which lead looks at the inferior wall of the heart? Roman 2, Roman 3, and a VF, V1 and V2, I and a VL, V5 and V6. Leads Roman 2, Roman 3, and a VF view the inferior wall supplied by the RCA. Question 6. What does a peaked T wave often indicate? Hyperkalemia, hypocalcemia, myocardial infarction. Normal finding in athletes. Tall, peaked T waves are a classic sign of high potassium levels. Question 7. Which rhythm requires immediate unsynchronized cardioversion defibrillation? Ventricular fibrillation, atrial flutter, sinus bradycardia, first-degree heart block. VFib is a pulseless, lethal rhythm that requires an unsynchronized shock. Question 8. What is the PR interval? The time from the start of the P wave to the start of the QRS. The time of ventricular contraction, the resting phase of the heart, the time between two heartbeats. The PR interval represents the time for the impulse to travel from the SA node to the ventricles. Question 9. A delta wave is a characteristic of which condition? Wolff-Parkinson-White WPW syndrome, left bundle branch block, pericarditis, right ventricular hypertrophy. WPW features a slurred upstroke to the QRS called a delta wave. Question 10. What is the EKG criteria for pericarditis? Diffuse widespread SD segment elevation. SD elevation in leads Roman 2 and Roman 3 only. Deep Q waves, tall P waves. Pericarditis typically shows global SD elevation and PR depression. Question 11. Which lead is considered lateral? I, a VHIL, V5, V6, V1, V2, Roman 2, Roman 3, a VF, a VR. The lateral leads view the left side of the heart. Question 12. If the PR interval is greater than 0.20 seconds, what is the diagnosis? First degree, AV block, second degree, Mobitz I, third degree block, normal sinus rhythm. A consistent PR interval 0.20 defines first degree AV block. Question 13. What does ROSC stand for in cardiac care? Return of spontaneous circulation, rapid onset of severe chest pain, rate of sinus contraction, right output system check. ROSC is the goal of resuscitation after cardiac arrest. Question 14. Which rhythm shows sawtooth waves? Atrial flutter, atrial fibrillation, SVD, ventricular flutter. Atrial flutter is famous for its regular F-waves sawtooth appearance. Question 15. In a 12-lead EKG, how many electrodes are usually placed on the body? 10, 12, 6, 4. A 12-lead EKG uses 10 electrodes for limb, 6 precordial to produce 12 views. Question 16. What is the primary treatment for stable supraventricular tachycardia SVT? Vagal maneuvers or adenosine, defibrillation, aspirin, epinephrine. Initial treatments for stable SVT include vagal maneuvers and the drug adenosine. Question 17. Which lead is located at the fourth intercostal space, left sternal border? V2, V1, V4, V6. V2 is directly opposite V1 on the left side. Question 18. What EKG change is seen in a patient with a left bundle branch block LBBB, wide QRS 0.12s and deep S wave in V1, narrow QRS, short PR interval, SD segment depression in all leads? LBBB is characterized by a wide QRS and specific morphology in V1 and V6. Question 19. What does a Q wave represent if it is deep and wide? Previous myocardial infarction, permanent damage, active ischemia, normal depolarization, right bundle branch block. Pathologic Q waves are signs of a past transmural MI. Question 20. The 1500 method is used to calculate heart rate by dividing 1500 by the number of small boxes between R waves, counting R waves in 6 seconds and multiplying by 10, subtracting age from 220, multiplying blood pressure by 1.5. The 1500 method is the most accurate way to calculate a regular heart rate.